Hi students, today I am going to discuss about the poison elimination, or this is also called as elimination enhancements. Here poison elimination means here we are going to removing the poison from the urine and blood. Okay, we are going to remove the absorbed poison from the urine and blood. Okay, in this the first method is forced diuresis. Forced diuresis means in this process we are removing the poisoning from the urine. Here we will increase the urine formation. We are increasing the urine formation by using of diuretics or IV fluids. These diuretics or IV fluids, these can increase the excretion of the drugs, their overdose, and we are going to treat poisons by using of diuretics. Otherwise we are going to use here IV fluids. Okay, mainly in this forced diuresis we are going to use this alkaline diuresis. This alkaline diuresis means this can mainly use to increase the excretion of acidic drugs, like salicylates and barbiturates. This is mainly in this alkaline diuresis we are going to use these compounds like sodium bicarbonate, and sometimes we will also use potassium to eliminate the acidic drugs from the urine. We can use this forced diuresis in the poisons of salicylates and barbiturates. Okay, the next one is extracorporeal techniques. In extracorporeal techniques, here we are going to removing the poison from the blood. These all extracorporeal techniques will done outside the body. In this we will removing the poisoning from the blood. Here we are using different type of dialysis techniques to remove the poison from the blood. The dialysis techniques are hemodialysis, hemoperfusion, peritoneal dialysis, hemofiltration, and plasmapheresis. These 5 dialysis techniques we are using to removing the poisoning from the blood. Okay, first we will see about the hemodialysis. The hemodialysis technique will done in the patients if the patient kidneys are not working. In that condition only we will do this hemodialysis process. This process of purifying blood of the person whose kidneys are not working properly. In hemodialysis technique we are using a dialysis machine to purifying the blood. This dialysis machine contains dialysis fluid. It removes waste from the blood. Normally this dialysis fluid contains different type of electrolytes, buffer, and glucose. This hemodialysis technique we can use in the poisons like lithium, phenobarbital, salicylates, amphetamine, quinine, heavy metals, ethylene glycol, and methanol. These type of poisonings we are using this hemodialysis technique. Okay, the next technique is Hemopperfusion. In Hemopperfusion, we are passing a patient's blood through a adsorbent. This adsorbent will absorb the poison material that is present in the blood, and it will purify the blood. Okay, we will see the Hemopperfusion. Normally it is a adsorbent. When we pass that poison patient's blood through this adsorbent, then the impurities, otherwise the poison substance present in the blood will attach to this adsorbent, and only after absorption only the purifying blood, the fresh blood pass through this adsorbent. Like this ways we are removing the poisoning from the poisonous patient blood. This is simply like a tea filter. Simply like a tea filter. In tea filter also we are pouring a tea. That waste products will settle on the filter. Only the fresh tea will come outside of the filter. Same like here also in Hemoperfusion we are using the adsorbent to purifying the blood of poisonous patients. Okay, this hemoperfusion technique will use the poisonous like barbiturates, paracetamol, salicylates, diazepam, phenols, dapsone and desoxyn. These types of poison we are using this hemoperfusion technique. Next one is peritoneal dialysis. In this peritoneal dialysis, we are doing this blood purification technique inside the body. Okay, normally in all extracorporeal techniques will done outside the body. In that only this technique, only peritoneal dialysis technique will done inside the body, inside the patient peritoneum only. We are removing the waste products from the blood. Okay, it is a patient peritoneum. Here we are using a patient peritoneal layer as a semi-permeable membrane. Through this membrane only we are removing the waste product. Here we are inserting the dialysis tube. Okay, dialysis tube. This side we have a dialysis solution. One side, other side we will have a waste products bag. One side dialysis solution bag, one side waste products bag. In this dialysis solution will go inside the peritoneum. Here the exchange process will takes place. Again the waste products we are removed from the poisoning. Again it comes back and it will goes into waste products bag. Like that we will do this peritoneal technique only in the patient peritoneum. This technique is not much used. It won't, many persons it won't use, because this process will take 24 hours of time. That's why we won't use much this technique. Okay, the next technique is hemofiltration. In hemofiltration, we will use a hemofilter to removing the waste products or poison from the blood. Hemofilter. This hemofilter contains semi-permeable filters. Through this, we will pass the blood through the semi-permeable filters and we will get the fresh blood. Okay, here it is a hemofilter tube. Here blood in, blood out. Here blood in, blood out. Inside will have, in this hemofilter, inside will have a semi-permeable filters. When we pass blood through the semi-permeable filters, the semi-permeable filter will filter this toxic blood and it will send only fresh blood to outside of the this hemofilter. Here we will have a reinfusion tube. Here we will have a reinfusion tube. This tube is useful to send if the patient need any replacement fluid like albumin or any fresh frozen plasma. Here we will reinfuse that albumin or plasma to the patient. Like this ways we will remove the poison from the blood through the hemofiltration. We have a hemofilter. This is full called hemofilter. Inside we have a semi-permeable filter to filter the blood. Okay, and this is the last technique in extracorporeal techniques, that is a plasmapheresis. Plasmapheresis means here we are removing or separating the plasma from the whole blood cells. Only we are removing the plasma from the whole blood cells and we are cleaning that plasma. Otherwise we are purifying the plasma and we will send return to the patient's body. Otherwise we will remove this toxic plasma and we will add another solution such as saline or albumin instead of the plasma. This is about plasmapheresis. In this, before this all techniques, the whole blood will purified, but in plasmapheresis technique we are only purifying the plasma. We are separating the plasma and we are purifying the plasma. Otherwise we are replacing the plasma with another solution like saline or albumin. This is all about the poison elimination or it also called as elimination enhancement. This all we are removing the poisoning from the urine and blood. Thank you.